I started seeing Dr. Trotter about 20 years ago, maybe more than that, and just as a general practitioner. And as I got older, he told me that I had diabetes and that I was going to change my life and that it was a progressive disease, diabetes is, and that I needed to start taking care of myself so it didn't get worse.
Diabetes is one of our most commonly diagnosed medical conditions here. Basically, diabetes is an elevated glucose that stays elevated most of the time. There's two types of diabetes. Type 1 is the type referred to as insulin-dependent diabetes. Those are generally patients that are diagnosed at an early age. Their pancreas isn't able to make enough insulin, and as a result, those patients usually require insulin at an early age. In our line of work, seeing adults only, we most commonly diagnose diabetes type 2, meaning adult onset diabetes. Those are patients that don't really have an elevated glucose until their 30s, 40s, or 50s, or even later. It's usually caused by obesity, not always. Sometimes there's a genetic basis, but 80% of the time, a diabetic newly diagnosed in our line of work is someone that's significantly overweight.
Dr. Trotter has helped me control my diabetes through lifestyle, medication, and eating habits.
The treatment options for diabetes are multiple now. We have a lot of new things to pick from, fortunately. In the old days, even as recently as 20 years ago, we had to use insulin and one or two medications that were available. These days, fortunately, we have medicines, some of which have now gone generic as their patent has expired, that can enhance the patient's own insulin sensitivity and effectiveness.
I like Dr. Trotter from the first time that I saw him 21, 22 years ago, and I've related to Dr. Trotter and his staff quite well. He's enjoyable, and that's the reason I've seen him for 20 plus years. Thanks to Dr. Trotter and catching it early, I think that I've led a normal life.